We continue our series for the children. Today we are discussing important vaccinations. Dr. Mark Strassburg joins us today with more information. Dr. Strassburg, thanks for coming.
Thank you for having me.
Now, vaccinations are important year-round, but tell us what vaccinations are important at this time of year.
Well, really all vaccinations are always important to all pediatricians. That's a subject very near and dear to our heart. All children, we recommend being vaccinated after birth starting at 2 months. We have a schedule that will continue on into their teenage years, and there's always a good time to vaccinate, and it's never too late to vaccinate.
Now, should parents be aware after getting vaccinated after birth, is there certain schedules that they should follow to keep the vaccinations up to date?
Absolutely. We have a schedule that's recommended by our American Academy of Pediatrics that runs and starts at 2 months and runs through 16 and 17 years of age, and even some adults get vaccinations as well. But we do follow that schedule as much as possible. It's been studied and tested, and is very beneficial as far as keeping immunity front and foremost in our children.
Okay, now let's mention some of these vaccinations that parents need to know about as soon as their child is born.
So when we do our 2-month visit, we typically are going to vaccinate against diphtheria, tetanus, and pertussis. We're going to vaccinate against rotavirus, which is a gastroenteritis virus. We also vaccinate against hepatitis B, and we will continue that during the first year. We'll also do polio. At 1 year, we'll do measles, mumps, and rubella, and chickenpox, and then at 4, we do boosters for those. And we can, once again, if a patient is late on their vaccinations, we have a catch-up schedule to help make sure that we keep them up to date.
Now, does health insurance usually cover these vaccinations?
Yes, they are all covered. They're covered, and we also have a Vaccines for Children's program. If you cannot afford vaccines, the state will cover that for you. It's a very, very significant public health issue, so you want to keep everybody as vaccinated as possible.
Absolutely. Now, let's talk about some of the middle-aged children, maybe in the late 10, about 10 years old through maybe 20. Is there vaccinations that need to be done at that age?
Yes, typically they're going to need a tetanus booster, and that should be given about every 10 years. And we're also putting diphtheria, we're putting our DTaP back in there because that helps prevent pertussis in our older children. A lot of our teenagers were vaccinated successfully when they were kids, but it tends to come back and they tend to infect younger children, so if we can vaccinate them. And we also do what's called our menactra virus, which helps prevent meningitis, and for our girls and probably boys at some point, Gardasil, which will help prevent against papillomavirus.
Now, some parents also there have been skeptical studies against vaccinations. Can you tell us anything about those and if they're to be disproved or if they're accurate?
Sure, and actually, to be honest, once again, that's a good important subject for pediatricians. Many studies have been done to see if there was a link between autism and especially the MMR vaccine, which we give it a year. There has never been any study to show a link. The one study that seemed to show has been disproven, and that the author of that paper actually has lost his license to practice in England. So for us, there has never been any study to show a link between those two.
Okay. Now, for parents, how important is it to keep track of when the vaccinations took place, and can they go to their doctor if they lose those records?
Absolutely. We actually, in Alabama and in many of the states, there is a record of database that keeps track of your immunizations, so we can do it for you.
Great. Thank you so much, Dr. Strassburg. We appreciate you coming by.
Thank you very much.
And if you have any questions for the Children, you can email us at morning@WTVY.com. And if you'd like to watch this interview or any of our past interviews, you can log on to our web channel at WTVY.com and click on For the Children.
Stick around, I've got a final look at your forecast when we come right back. Plus, Mr. Food is making a delicious chocolate eclair cake. And don't forget, Dimitri and I are on Facebook, so send us your comments or questions or join us in a discussion. We'd love to hear from you.